T-Bone and Heather on Star 98.3 and 97.7 The Bay.
Yeah, you got that right. It's 10 minutes after 8 o'clock, 8:10, and joining us on the phone lines this morning, Dr. Polsky. Sir, are you there?
I am. Good morning to you.
Good morning.
Good
Thank you
morning.
so much for taking a couple of minutes and chatting with us again. Dr. Polsky was on the air with us, about a week ago. He is the health officer for Calvert County. He's a guy that knows stuff, so we're going to talk to him.
And what a difference a week has made, Dr. Polsky. Has the virus mutated? Has it done something different? Or is it pretty much stuck to what it's been doing right along?
Well, we don't know of any further mutations. That's always a possibility in the future. I think that the big change in decisions that came out of Annapolis yesterday were based on new information that's come about over the past week and primarily out of the experience in Italy. So what they were seeing in Italy was a small number of deaths up until about March 1st, and then they hit this inflection point. And from March 1st to March 10th, they went from a total of 40 deaths in the country related to coronavirus up to over 800.
Mm-hmm.
And it does not mean that in the U.S. that we would see the same thing that they have seen in Italy, but the question that can never be answered is, when are you right before that inflection point? When are you at the point where all of a sudden the severity and the number of illnesses are going to ramp up dramatically?
So, Doctor, when people hear that and they hear those numbers and they go, oh, my God, 800 deaths. And so let's just cut to the chase. And again, you correct me if I'm wrong, if something has changed over the course of the week, then I'm open to new information. But let's say the average person with a, relatively healthy immune system gets this virus. The mortality rate was somewhere around 98% of people who will get the virus would pull through. Has that number waffled? Has it changed?
Well, I think the best information is that number is lower. But we live in a country with over 330 million people,
Mm-hmm.
and so and we see this all the time. So with the flu, where I know the number has been quoted is 0.1%. Well, it's an average year. So 3 years ago, the number of flu deaths were about quadruple what it would be in a typical flu year. 0.4%. But that meant 80,000 deaths across the country.
Wow.
Right.
And so even when you're talking small percentages, in a large population, you're talking a huge number of deaths, and that does not take into account all the people who end up in ICUs, on ventilators, and may have long-term complications because of the illnesses that they had. So most of the precautions, actually all the precautions that we talked about last week, are still in effect. People should still be taking time to properly wash their hands. They should certainly be staying at home if they are starting to come down with an illness. All those things are still there. It's just that we're continuing to gain knowledge every week that goes along.
Okay, I have a couple of questions, Doctor.
Callers have called in and
they
said, hey,
have.
ask him this. So
But this is a question that I was thinking about the other day, and I heard the gentleman from the University of Maryland, their medical center, speak, and he said, here's the problem with this virus. A lot of the symptoms are very mild, moderate. People don't even realize they have the coronavirus, and they do whatever, take some NyQuil, and then it's gone. The denominator could be higher. Like people could have had it and not even known that they had it. Is that correct?
That's absolutely correct. And that started to mention that when T-Bone talked about what percentage of people would end up with a fatal illness, that I think that the percentage is lower because the vast majority of people who have been tested have been on that higher end of the spectrum as far as their symptoms. That people with mild symptoms, by and large, have not been tested. There was a study, and I might have mentioned this last time, but I've been talking to so many people over the last week I can't recall.
You should only talk to us.
There was a study that from the World Health Organization, a team that went out to China after the initial wave of illnesses, and they found that the mortality rate, or the percentage of people who died, was closer to 0.4%, and that's I think based on all the reports I've seen from different countries with different medical experts, that's probably closer to the true fatality rate. So, as we talked about when we compared with the flu, even if it's as low as 0.4%, we're still talking somewhere between 75,000 and 100,000 deaths in the U.S. if this was to spread throughout the whole population.
Okay, so with the governor's edict yesterday, the schools are closed. How do we know 14 days is the magic number? How do we know when kids go back to school on the 30th that we don't hit that point that you had talked about earlier where, it's just this virus is just raging? How do we know 14 days, Doctor?
14 days, we know, is the extent in which if someone gets exposed to the virus, we would have seen that they become ill or not. But the 14 days, as far as school closures, I think that's a fluid date. And I'm not sure exactly the wording that they used yesterday, but 14 days is a starting point. And then if they continue to see transmission, I can't speak for the governor.
Sure.
I speak for the Secretary of the Maryland State Department of Education. But I would not be surprised if they still see significant, whatever that would mean to them, and the epidemiology experts that they are working with through University of Maryland and Johns Hopkins, that there's a potential that could be extended.
Oh, yeah, that's what I was thinking, too, because it's hard to, I mean, the virus doesn't know 14 days have elapsed and kids need to go back to school.
Well, and I would just, and one thing I think that we need to emphasize at this point is that you can shut off one avenue of transmission, meaning in the schools,
right,
but then you potentially push transmission into other areas, which we already are reaching out to all the daycares in Calvert County today to make sure, because they're going to have an increase in number.
Yeah, they are.
Oh, my gosh, yes. So what do you suggest, not only to Calvert County daycares, but region-wide, Doctor? What do you suggest to those people who are in charge of those facilities?
Yeah, so the other bit of new evidence since we talked last week is it's not definitive, but there seems to be increasing credible evidence that in addition to transmission through coughing, respiratory, that there is likely also fecal oral, or as in other terms, through poop.
Right.
Be transmitted, and certainly in daycares where you have staff changing diapers, where you have toddlers who or 3-4-year-olds who may not have the greatest hygiene after using the bathroom.
Sure.
And you have meals being served in daycares. Kids who may have only been going, say, after first, second grade, just going for about an hour after school until their parents could pick them up, are now going to be eating lunch there. So our message to daycare providers is they have to be extra conscientious about hand washing after any diaper changes. For little ones who are using the bathroom on their own, and they may be helping out to make sure that everyone's washing their hands, and then an extra thorough hand washing before any meals or beverages are served at the daycares.
Okay, let me ask you this too. Is there any truth to the rumor that kids are not as susceptible to this? I've heard that over and over again, that kids don't get it as much as other people.
We certainly have seen far fewer infections in children, but as we've been talking about last week and this week, that it's a relatively small percentage of people who are getting tested. So as far as illness, I think it's very clear that children, teenagers, it's unusual to see them develop any sorts of severe infections. Whether they're actually just not getting infected or not is hard to say, because we just don't have the testing data to back that up. And I will throw in one caveat to that.
Sure.
For children and teenagers who have certain immune system problems, and that could be juvenile diabetes. Unfortunately, there are children who get cancer and need chemo. There are children who have heart or kidney transplants and are on immunosuppressant medication. Those children are at high risk. And so for parents who have children with underlying significant health problems, they still need to be extra vigilant to make sure that their children are not getting unnecessarily exposed. And this doesn't go just for coronavirus, but for influenza and for other infections as well.
Well, we're talking with Dr. Polsky, Calvert County Health Officer. This is a very specific question to a very specific listener who called in right before you were on the air, Doctor, and I promised I'd pass the message along. He just got a pacemaker put in. He said, is that pre-existing?
The pacemaker should not put him at higher risk, although I will say that for some people who need a pacemaker, they may have other underlying cardiac issues that could increase the risk. So I can't say for any one specific person just based on a pacemaker. That's a discussion, and this goes for a lot of people who are listening in who have underlying health conditions, that at the start of every flu season, they should have a discussion with their physician or nurse practitioner if there are particular precautions that they should be taking. And I will just throw out there for the flu that we concentrate on the individual themselves, but what's very important is that people who come in close contact with them, other family members, coworkers, that for the flu, since vaccines are available, that they get vaccinated so they don't inadvertently pass that infection on to people who are more susceptible.
Okay, now a couple of questions, and these are from listeners, and they're interesting questions. I don't know if I know the answers, but I'm going to ask them because they're curious. Number one, we had a woman call in yesterday, and she said she was told, chin up, cold and allergies, chest, COVID-19. Well, I mean, that's obvious. Should we try to self-diagnose that way? Especially with allergies. I mean, you don't want a bunch of people running to the hospital or their doctor's office if they just have allergies. How do they determine what the difference is?
And so I'm not sure that a blanket statement like that can be made. And so for people that have chronic allergies or asthma where they know they have a certain amount of typical cough, what they really should be looking for is there a change in their baseline. And there isn't coronavirus doesn't have to present this way or have to present that way.
Okay.
So again, I would look more toward, for people with chronic respiratory sinus problems, is there a difference now than there was, say, a week or two before?
Any evidence that alcohol helps? Drinking.
Some of our listeners said
they heard that alcohol.
Yeah, you get good and tore up and stay drunk, you'll be fine.
Yeah, so alcohol, especially for people who drink on a regular or chronic basis, that does stress the liver. The liver actually plays a specific role in antibody production. So for people who drink chronically, they're actually more susceptible to getting infected, and then once the infection takes hold, they're more at risk for severe infection.
Because I was going to start drinking. I got to be honest with you.
Okay, this was from another listener, and we've all seen him, Dr. Anthony Fauci, and with the White House guy, and he's saying obviously that this is going to. I think we all thought that it was probably going to get worse, like more people were going to get it. What are the numbers? Because T had some numbers this morning where it's
there was a guy in Congress, I guess he's a doctor, I don't know, some chucklehead in Congress. He said, let me tell you how this is going to go. 150 million Americans are going to get this, and of that, you're going to look at maybe 4.5, maybe 6 million people are going to die.
Now, does anything,
I think that's ridiculous.
Is that what you guys are talking about, Doctor, that it could be that high?
No one knows what the current incidence is. Anyone who comes out with a specific number is just extrapolating off of whatever methodology that they're using. But the reality is that nobody really knows. And that's one of the big frustrations from a health perspective.
Sure. We
can't really assess risk as precisely as we would like to. And for the public, that engenders fear and stress. That
right.
Don't really know what the risk is right now. And then to make projections, especially when you start, the more people are taking reasonable precautions, basics, staying at home at the first sign that they become ill, better hand washing, all the things that we've been talking about over and over.
Right.
The more people are abiding by that, the fewer cases we're going to see. If people are more, this isn't really a big deal, yes, we are going to see an acceleration. It's just a question of when.
Doctor, does this virus like warm weather? It's going to be like 80 today. Is that helpful or is it hurtful or it doesn't matter?
A day or two, it doesn't make any difference. Again,
right.
Okay.
People who can transmit they're going to transmit the virus for at least a week, so an occasional day. It's more when we see ongoing warmth, which hopefully won't be that far away.
Right.
And we talked last time that Easter, Passover, time is potentially going to throw a little bit of a wrench where families are going to get together and we may see some sort of spike. It could be small, it could be more major, probably that week or two after the holidays.
One more question, Doctor. For folks who are out there and maybe they are feeling a little under the weather, as my grandmother would say, a little puny, so where do they go to get these tests? What do they do?
That's something that not only in Southern Maryland, but really all across the country is a work in progress.
Oh boy!
We I think it's been acknowledged that there just are not enough tests for everyone, and so doctors have been making decisions as far as how this would affect management. And doing a test for the sake of doing a test, for anything is not a great idea. For someone who's otherwise young and healthy, if they test positive, there's no specific treatment, so the recommendation is going to be, again, to stay away from other people for a little bit, let the virus go away. For people who it potentially could make a difference as far as management, again, not a specific treatment, but as far as how a doctor would monitor them and would they need to come into the hospital, those are the patients that have been selected most for testing. But our hope is that over the next week or two that we'll see an increase in availability.
Dr. Polsky, we cannot thank you enough. I know how busy you have been, and you're talking to people all over the country and trying to help out and do. And I thank you so much for taking the time to call and talk to our listeners. And maybe I'm hoping abate some of the fears that are out there. It's pretty much just the standard. Wash your hands. If you're feeling sick, stay home. The kids are out now. It's just practicing good hygiene and be smart if you become sick.
That's absolutely correct, and it's been a pleasure to join you again.
Well, we may talk next week. I may have a desperate email to you to get you back on the air.
I see the potential that we may do a weekly for the next month.
I
think that might be.
I love
Doctor, keep yourself healthy because we need good health professionals on the front line, and thank you for your time this morning.
All right, take care.
All right,
Thank you.
That again, Dr. Polsky is the Calvert County Health Officer, and he knows his stuff.
And he's no nonsense. I just dig him. I really dig him. I just like the way he explains everything. And
take care of yourself. Wash your hands. If you're sick, don't go to work.